Hi, I'm Mecca. When I was growing up, I was always a daddy's girl. My father passed away in 2002 of hypertension. He was first diagnosed when I was in the 9th grade, and when he passed away, heart disease became very important to me. What I would like for you to do is think of someone who you may know who suffers with heart disease. It may not be someone close to you, it may be a friend of a friend, but as we go through this discussion, just keep them in mind. The goal of this presentation today is to define hypertension, discuss 2 common causes, and also to discuss the preventative measures of hypertension. According to the medical news today, hypertension is defined as high blood pressure, transitory or sustained elevation of systemic arterial blood pressure, which is to a level of likely to induce cardiovascular damage or other adverse consequences. What blood pressure is it's the force of blood flow that goes through your blood vessels. And when you go to the doctor, you always, when your office visits, you get your blood pressure checked. There's the first number and there's a second number. The first number is called the systolic number. According to Diffin, the systolic number measures the amount of the pressure that blood exerts on the arteries and vessels while the heart is beating. The second number, the diastolic number, is the pressure that is exerted on the walls of the various arteries around the body in between heartbeats when the heart is relaxed. Now that we know what hypertension is, the true definition, blood pressure, now we have to think about what are the common causes of hypertension. I'm going to discuss 2 of those causes with you. The first is going to be smoking, and the second will be diabetes. Smoking, as you know, is the worst thing that you could possibly do to your body. According to Norman Kaplan, chronically cigarette smoking induces artificial stiffness, which may persist for a decade after you quit smoking. The incidence of hypertension is increased among those who smoke 15+ cigarettes per day, and the coexistence of hypertension and smoking decreases the left vertical function of a abdominal person. So basically what that means is as you continue to smoke, every cigarette that you smoke, your blood pressure increases by a certain number. And after 30 minutes of having the last cigarette, the number decreases at times. So if you go to the doctor and you had a cigarette on your way there, by the time that they go ahead and take your blood pressure, you may have a lower number. So sometimes it's a little hard to tell if you are suffering from hypertension or heart disease. The next factor that we're going to discuss is diabetes. Diabetes has a lot to do with hypertension. A lot of people don't realize the effects that diabetes and heart disease play hand in hand. According to the American Heart Association, your heart has to work harder when blood pressure is high and your risk for diabetic problems increase. And with diabetes, just a little history with that, it actually hardens your arteries with the insulin that is not there, and sometimes with obesity, so it affects your heart. And with that, with the heart, it having to be the blood going through your vessels, it's hardening, so it's harder for the blood to do that, which causes the high blood pressure. Now, how do we prevent hypertension? The first thing we're going to go back to is the smoking. If you do smoke, the best thing to do is to stop smoking. You can actually go to different websites that are out there. You can talk to your doctor that can help you take steps into stop smoking and quitting, so you can decrease your chances of having a heart attack, having a stroke, and having that hypertension. The next thing would be to maintain a healthy diet. That also goes with the diabetes. So when you're out eating, you want to make sure that you're putting something that's in your body that is beneficial to you. So just think about when you go out to eat, is this going to be too much salt? How is this affecting me in a positive manner? And exercise. Exercise is good all the way around, not only just to prevent heart disease, but also to just maintain a healthy lifestyle. So what we've talked about today, we've talked about the definition of what hypertension is, we've talked about blood pressure, the differences between the two numbers within the blood pressure, the two most common factors of hypertension, and also ways to prevent hypertension. And what I want you to think about is the fact that, going back to the beginning, my father, he doesn't have the chance to go back and redo things over. And someone that you may know may not have that chance or is fighting with this disease. But you and I, we do have the chance to take different lifestyle approaches, stop smoking, stop drinking as much, watching what we eat, exercising to make sure that we don't have this fatal disease. And thank you.